Hello, this is Kimberly Allen, and this is segment 3 of 8 regarding the role of peer recovery and family support in optimizing integrated health outcomes. So I'm really excited about this presentation. We're talking about peer recovery and family supporters working in acute care and hospital settings. So it's exciting. We can see actual examples of how peers are being used right now. This project is part of Texans for Recovery and Resiliency, and TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation for Families for Children's Mental Health, and the Addiction Recovery Community Statewide Network, RecoveryPeople. And the purpose of this collaboration is to strengthen peer and family voices in mental health and substance use recovery, policy, and program development. So we're going to start off in acute care settings. Peers do work in acute care settings, and an example of an acute care setting is an emergency room or a psychiatric emergency department. So there are challenges in acute care settings. Many individuals with mental illnesses are repeat users of the emergency room. There's an increase in patients remaining in the emergency department after the decision has been made to admit or transfer them. This creates chaos and crowding in the emergency room. So known as patient boarding, a lot of the time, we see mental health or clients with substance use disorders remaining in the emergency department after they've come in due to mental illness. There are challenges within acute care settings. For one, the follow-up after discharge from an ER or a hospital is consistently low. So a lot of times you see that back and forth going to the emergency room, and part of it is that there is no follow-up after discharge, so patients are sort of left to themselves. To prevent repeated visits, individuals discharged from an ER should have access to comprehensive outpatient and community-based recovery-focused services. So this is really our focus today. How can we do that? Peer supporters and family partners provide social and emotional support for patients identified as having substance use disorders and/or mental illness. They can talk to families in crisis, perform active listening, provide recovery support and information on community resources. So we hope to coordinate with community services. This is a prime component of successful integrated care, and we help clients access community services. So this is more than just sticking a list in someone's hand and saying, here are referrals to a food bank or referrals to a mental health community service. We actually help clients access those services or patients to access those community services. That may look like helping them make phone calls or assisting them in getting there, whatever we need to help people access care. So this is how acute care systems actually do use peer support. This quote is from an integrated system with 50+ beds. It's part of a med-surg hospital with over 500 beds. And he states, we have a psych emergency room that has about 20,000 visits per year. It's had a huge impact to have peers there to talk to people in crisis. So this is something that they use in their psych ER every day. And he says it's had a huge impact. Patients come in from the main ER and the psych ER. Psych ER has embraced peer services. They inspire some hope. They make referrals for support. They also visit the main hospital. They give a general hospital orientation, and they make referrals for support. So this quote came from a director of nursing from yet another 500+ bed hospital. And as you can see, the psych ER has embraced peer support. Initially, they really didn't know what it was, and now they're extremely involved in it. So let's talk about hospital systems. Many times people come in through acute care, they've come in through the emergency department, and they're referred into the hospital. So within that system, peers talk with patients, they collaborate closely with mental health and medical nursing providers, they provide hospital orientation and hospital visits. So peers actually go into the rooms and talk to patients about how they're feeling and what's going on and share their lived experience. So this is different than social work. This is actual peers sharing with other individuals, and they have the same life experience. Peers help patients with their individual care plans. They help patients set their own goals, and they provide ongoing support throughout the course of treatment. So the care plans are individualized. The patient actually has input and helps set their own goals. This is not something that's imposed upon them or taught to them, but rather the patient contributes their own ideas and wishes throughout this process. Peers work jointly to co-lead or lead educational groups for patients with mental health and or substance use disorders. So there's a lot of education that peers can provide to people that are in the hospital. Peers can also conduct or co-lead discharge groups. They can work in discharge areas alongside behavioral health specialists like licensed clinical social workers. They can assist with discharge planning. They can provide information on community resources such as recovery support groups, housing, transportation, things along those lines, and then assist with coordination within community services. So I saw a lot of this or heard a lot about that where peers are working in discharge areas, very helpful to the hospitals. Post-discharge, the peers can reach out to patients. They can provide flexible contacts such as check-in through telephone or in person. They can provide different intensity of support during follow-up to meet individual needs, and they can support clients in meeting their identified treatment plan goals. So this kind of check-in and outreach and support to patients is appreciated by them, I'm sure, and they keep up those flexible contacts. It's whatever works for the patient. Peers perform home visits for patient self-care. They help patients to sustain behaviors in daily living, and they help support goals in nutrition, exercise, and healthy living. So we want people to be resilient and learn about healthcare and then keep on doing that, keep supporting those goals. The results of this has been that peers have helped to reduce recurrent psychiatric hospitalizations for patients at risk for readmission and help to reduce expensive inpatient service use. We'll be talking more about this in later segments where this has been demonstrated, where peers do reduce current psych hospitalizations. So if we look at some specific examples, I'm going to start by looking at a psychiatric hospital that is actually using peer support. This is a short-term crisis-oriented inpatient psych hospital they're part of a medical surgical hospital that has, the psych hospital has over 100 beds and they have 35 physicians on staff. They also have integrated care through their outpatient services. So those patients receive high-quality care by physicians who specialize in mental health and internal medicine at one location. So they have psychiatrists that offer med management. They have internal medical docs that offer a wide range of primary care services. Their services include licensed therapists. All of those people collaborate as a treatment team. So this is true integrated healthcare where we see a team of people involved in treating patients. I asked when this hospital and why did they start using peer support? And the nurse with over 20 years of employment with this work group said, I remember we were having problems with case management, issues and discharge planning. Patients were not improving. There are resources but people did not follow up. So this gives you an example where we may give patients some resources, but you see people not following up. Well, what can we do about that? The peers work more directly and people get tied in, pardon me. Let's see, which way did I go? The peers work more directly and people get tied into resources immediately. Our hospital now uses 3 to 4 peers 7 days a week. We have used peers for the last 10 years. So once this organization started using peers, they use a fair number 7 days a week and have done those for 10 years. So I can say that I find them to be extremely happy with a direct tying into resources that peers have provided their patients. Here's another example. This is a 500 plus bed hospital. They do use peer support program. They now employ 5 full-time peer recovery specialists who are known as peer navigators. And those people are in recovery from their own struggles with substance use or mental health problems. This program also includes a clinical pharmacist and a social worker. So once again, pardon me, we see a team of persons working with peers, and we have clinicians, and they work together. In the main and psychiatric emergency departments, the peer navigators meet with patients who have been identified with possible mental health or substance use problems while they're waiting to be seen by a clinician. In addition to helping patients feel more at ease by offering support and sharing their stories of recovery, the navigators provide information about the peer recovery navigation program. So this was a director of nursing who was talking about the peer navigators. And that term, you'll notice that peers often have different titles. In this case, this organization calls them peer navigators. So they actually go up to patients while they're waiting. And I'm sure that a lot of these patients that are waiting in the main ER and the main psychiatric ER really appreciate and need that kind of support. And as you can see, they've been identified with possible problems. So there's been some form of screening there. So these individuals we know need help and support. Once patients are enrolled in the peer support program and are discharged from the hospital, the navigators call on them once a week for 60 days, providing peer recovery support, referrals to the pharmacist for medical needs or a social worker for housing and transportation challenges or other social issues. They provide information about other available community resources. So this is really important. We see those disconnects when patients are discharged from the hospital. A lot of time people may go through an emergency room, they go through the hospital, they're feeling better, they're doing better, they're discharged, and then there's no support. So some people may also not be able to afford the kind of support like seeing private therapists or private psychiatrists. They may not be able to afford that, or they may not want to do that. So we see the navigators, the peers, calling them once a week for 60 days. So that gives people a nice, fair shot at recovery, providing support and referrals, which are 2 things peers are really, really good at. The result from this is that in year 2015, the hospital has enrolled more than 1,200 patients in the program. I know that they are increasing that number. And the director of nursing in the hospital said they have filled a need on what was missing in our system. We needed to ask what helps them, the patient. So this nurse was really a champion, as we say, for the program. She was part of the person that asked what really helps these patients. So, we have to ask the patient, what would really help you? And this was their solution to come up with utilizing peer support. And clearly the program has been successful. Here's an example of a 50 plus bed hospital using peer support and family partners, so they used both. This is the psychiatric department of a large hospital. They're at the forefront of integrating services into their entire continuum of care. Peer support services are frequently implemented as components within existing services. So what that looks like is the hospital provides case management, lab work, med management, and they have begun to integrate behavioral health needs relative to their medical needs. So this includes the use of behavioral health screening for patients who may be at higher risk, for example, for depression. So these embedded behavioral health specialists work side by side with primary care providers. They are indeed identifying patients and then or individuals. The patients that are referred to the psychiatric department is where we find these peers. So I interviewed a leader, an administrator there. They said the peers work in the emergency room. They're used as transition agents. They're part of our transition coordinators team, and they are just now starting to work in our 6 outpatient facilities. So clearly the peers have done well working as transition agents and provided a lot of care, and this organization has been very happy with peers. So they are integrating peers into their outpatient facilities, and we love hearing that. They're busy throughout the day. They hold groups, they sit and talk with patients, they connect with patients, and those peers have used services at their facilities. So he's identifying who they actually are. These particular peers have gone through their facility. The peer navigators co-lead recovery support groups on their unit, their psychiatric inpatient unit, twice a week, and they conduct education. Peers can predict the risk of readmit, so they're assigned to do discharge groups and call patients after discharge at home. The goal is to reach out to patients and have them attend follow-up. So I thought that was really interesting that they feel that peers can predict their risk of readmit. So when they listen to people, they can hear who they think may potentially be readmitted to the psychiatric unit. So they do a lot of follow-up reaching out to patients so that the patients will attend follow-up. So they make patients more comfortable and at home. So this is an example of what the peers actually do. This is according to that facility. I wanted to take a closer look at the actual functions. The peer provides information, which means they help patients become familiar with a new program and determine what resources they need for recovery. They assist patients in gathering information to solve problems. So this is helping patients solve their own problems. So the peer just gives information. Peers provide support. So they provide opportunities for structured or informal sharing of encouragement between patients and peers. They provide enjoyable interactions with patients to lessen the feelings of isolation. So we all know how isolation affects us and how isolation can affect patients. So we really appreciate this opportunity for sharing and encouragement. Advocacy. Peers work formally and informally to reduce stigma associated with mental illness. They work to foster respect for and protect the rights of those living with mental illness. They provide inspiration, providing patients with examples of successful recovery experiences. They instill hope in patients, and they act as role models. They articulate goals and the means necessary to reach those goals. So I really loved hearing that peers instill hope. My personal belief is that we instill hope just by our mere presence and acting as role models in our own resiliency and recovery efforts. Finally, peers provide empowerment. They encourage patients to believe in themselves and to hold on to hope for recovery and reach for the means to achieve their recovery goals. So empowerment and encouraging patients, this is something that we peers are all about. The reason I say peers is I am a certified peer, so I must say we. This was something that was a little more unique that I heard that was provided by this healthcare system. Peer supporters and family partners with lived experience work on patient and family advisory councils. I didn't know a lot about patient and family advisory councils, and maybe you don't, so let's explore that a little further. This administrator says that this health network has a lived patient and family advisory council, so I wanted to find out more about that. So I called an administrator that utilizes this. He was kind enough to talk to me about this, and he said that they have 12 to 15 members of families and patients that meet once per month. And it is a formal process, but they are volunteers. And he said most major policy decisions are run through that group. They also assign one member on the Quality Improvement Committee and one on each initiative to improve the recovery area of care. So there is a champion from that council. The council challenges us. As one example, they totally redid the discharge process. So I really appreciate him sharing that with me. So the purpose of that council is to build respectful partnerships between patients, families, and the rest of the healthcare team, to increase teamwork between patients, families, and the rest of the healthcare team. So there's respect and teamwork to ensure services meet family needs and concerns. So the family is really involved in this. It's not just the patient, but it does include the family. Another thing they do is offer a forum for creating cost-effective solutions to challenges faced by patients in the health network. So cost effectiveness is something that they do. All of their recommendations that they make don't supersede what people can afford. So their actual responsibilities are to improve communication between patients, families, providers, and the rest of the healthcare team. They provide input into policies, processes, program development as requested. They share information, needs, and concerns with the healthcare team, and they promote change in a positive way. So they're very, very involved in communication between these groups. So we don't see those disconnects that we see in some healthcare systems. They also give input into education for the healthcare team. They provide opportunities for the staff at this organization to listen to patients and families, and they improve access to information for patients and families. So this is an outstanding organization. You can find information about this on their website, and I really, really appreciate their contributions and continue to. The results, as stated by the administrator, are that they are an equal partner in all that we do, including partial hospitalization and intensive outpatient programs. It has had a huge impact to have peers there to talk to people in crisis. The peers are very advantageous. So if you'd like to learn more about these resources, you can review the other videos in this series. There are 8 of them. You can contact me at KimberlyAllen@RecoveryPeople.org, or you can look at our website at RecoveryPeople.org. We also have a website, Recovery and Resiliency.org. Thanks so much for listening today.